minute. Got the 1 minute from the man. Stand by. This is your 1 minute warning. Yeah.
Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control. I'm joined today with Commissioner Pender, Makin, the Commissioner of Maine's Department of Education. And Commissioner Makin and I are here to provide everyone an update on the COVID-19 situation across the state. Overall, the Maine CDC is now reporting 1,603 cases of COVID-19 statewide, which represents an increase of 38 cases since yesterday. Of those 1,603 cases, 1,437 are laboratory confirmed and 166 are probable cases. Overall, 211 individuals have been hospitalized and 35 individuals are currently in the hospital. Of those 35, 16 are in the intensive care unit and 19 are in non-intensive care unit beds. And as of today, 8 individuals across the state are on ventilators. Sadly, as we've discussed, there have been 69 individuals who have passed away with COVID-19 and 993 who have recovered thus far. Of our 1,603 cases, 354 have been among healthcare workers. And thus far, Maine CDC epidemiologists, medical staff, and clinicians have fielded 6,686 requests for consultation. I want to just touch on a couple of other areas. The first is an update on our laboratory. As Governor Mills noted and announced, we have recently entered into a partnership with IDEX in order to greatly expand our state laboratory's ability and capacity to conduct testing. Since announcing that partnership, the Maine CDC laboratory has been undertaking the necessary scientific steps that are required in order to bring that testing fully online. That project is going as scheduled, and we project that by Monday, just in a couple of days from now, Maine CDC's laboratory will be online with the new testing materials and reagents provided by our colleagues over at IDEX. I'll have much more to discuss on that topic on Monday, as well as the implications of that expanded capacity for our overall strategy and approach to testing statewide. I'd also like to touch on a topic that we talked about yesterday, which is concerns that were raised by a journal article published by some researchers about the Abbott ID Now device. As it turns out, in addition to that news yesterday, the US FDA itself issued a document that also raised some concerns about that device. We at the Maine CDC, since we began distributing those devices across the state, have noted some of those early pieces of data and have continued to keep physicians up to date on some of those concerns that are out there about the accuracy. I want to be really clear about that. What we know about the test's performance so far is that if it returns a positive result, we can have high confidence in that. You can take a positive result to the bank. But a negative result, the science is still out on how to best interpret that from a clinical perspective as well as from a public health perspective. That's why Maine CDC has continued to communicate with physicians and healthcare providers that if they believe that a particular individual strongly has all the signs and symptoms of COVID-19, if their clinical suspicion for COVID is high, if they run that patient sample on the Abbott device and it comes back negative, they should look upon that with a question mark. They should immediately treat that patient as if they were COVID positive by providing them the necessary public health guidance to stay in isolation and avoid contact with others. We've also asked Maine clinicians to send us a nasal swab sample so that we can run a confirmatory test. That's been happening. As it turns out, just earlier I was on a call with some clinic operators who have indicated that they've done just that. And thankfully, in many situations, the negative result was confirmed by Maine CDC's laboratory. But there's still more science that's being done, and as that science is underway, we're going to keep those protocols in place so that we don't accidentally let somebody who might have the disease walk out the door. I'd also like to provide now an update on some of our overall public health preparedness activities. The first thing I'd like to update everyone on is some more news around the distribution of a drug called remdesivir. Earlier this week, I talked about the fact that Maine CDC had received from the federal government a shipment of 10 cases of remdesivir, which we immediately turned around and distributed to hospitals. Earlier this morning, Maine CDC received notice again from the U.S. government that we would be receiving an additional 7 cases of remdesivir today. A few hours later, a few hours ago, we did receive those 7 cases, and they are currently in transport to hospitals across the state right now. Overall, these 7 cases can be expected to treat approximately 35 patients across the state. Remdesivir is a drug that has been studied in other applications before, and there are some early data that have been conducted by the National Institute of Health, which suggests that it can shorten the number of days that someone who's seriously ill needs to be in the hospital for. There's a lot of clinical study going on right now about the overall effectiveness of the drug and other ways that it can be used. But what we want everyone to know is that we are working very closely and in partnership with hospitals and healthcare providers across Maine, such that when we receive shipments of the drug, we're able to push it out immediately so that doctors and other healthcare providers in Maine have yet another tool in their belt that they can use to provide the best care for patients who are in the hospital with COVID-19. We're not sure yet about how much more remdesivir, if any, the state of Maine will continue to receive. We know that the federal government is working very, very hard with the manufacturer of the drug to continue to secure more supplies. And as we learn more from our colleagues and counterparts at the federal level, we'll keep everyone up to date. But for today, the 7 cases that we've received are on their way out and should be arriving at hospitals across the state of Maine as we speak today. In addition, our colleagues at the National Guard have continued their exemplary work on getting as many healthcare providers across the state fit tested so they can make use of N95 masks. Just yesterday, the team at the Guard fit tested 78 healthcare workers, and today, on May 15th, they are fit testing an additional 130 staff members at locations across the state, from Portland all the way across the state, from north to south. Thus far, 738 individuals, healthcare workers, have gone through fit testing training by our colleagues at the National Guard, but their mission is not yet over. They still have an additional 500 individual healthcare workers that they intend to fit test in the coming days and weeks. We again thank our colleagues, the men and women at the National Guard, for joining up with us to fit test as many healthcare workers as possible. We've been continuing our distribution of personal protective equipment across the state as well. By the end of today, Maine CDC will have fulfilled nearly 1,700 orders for personal protective equipment to healthcare providers, local fire, rescue, and EMS groups across the state. We still have many more orders to fill as those orders come in, and this is what our public health emergency preparedness team does on a daily basis. We intend to continue that operation to make sure that frontline emergency and healthcare workers have the PPE that they need in order to stay safe and continue to provide healthcare to each and every person in Maine. Next, I'd like to provide an update on the various vital medical assets across the state. The first is the total number of intensive care unit beds, which stand at 357, 156 of which are available. In terms of ventilators, there are 307 ventilators across the state, 248 of which are available, and there remain available 420 alternative ventilators. Finally, an update on the outbreak front. I would like to note that there have been 2 outbreaks that have been where we have gone, again, more than 1 incubation period without any new cases. These are both in Port Resources facilities. We'll have more information about those over the weekend or perhaps a bit later today. This is information that just came in, but there have now been 2 additional facility-level outbreaks where they have gone more than 1 incubation period without recording any new cases. Maine CDC is also now classifying an outbreak at the Durgan Pines facility. Just a few hours ago, we were made aware of now 3 confirmed cases at that facility. Our team of epidemiologists is touching base with that facility to make sure that they have all the public health guidance they need. That comes on top of the facility also receiving shipments of PPE. Just in the past several weeks, the facility has received approximately 330 N95 masks and about 1,450 surgical masks. But any response to an outbreak involves first and foremost making sure we're providing quick, adequate care for the patients in that facility, and then providing epidemiological, clinical, and PPE-related advice to the facility. Our teams of epidemiologists and medical officers will continue that discussion as we learn more about the dynamics at that facility. And as we do, we'll have more updates for everyone. So I'd like to turn things over to Commissioner Makin now. Commissioner?
Thank you very much. I'm pleased this morning, or this afternoon, to share with you that the Maine Department of Education has secured internet connectivity for nearly 22,000 Maine students who previously had no way to connect with their schools, their education program, and their teachers. This effort has been a combined one featuring input from teachers, parents, students, and school leaders, our partners at Connect Maine, and our partners at the Department of Administrative and Financial Systems. Through this combined effort, we've been able to identify how many students actually haven't had connection because of the lack of broadband or because of the lack of resources at home to tap into a broadband that might be available. We, prior to the pandemic happening, we identified the lack of connectivity in Maine homes as being a very concerning inequity. And as a result of the recent pandemic, that has come into a full-blown crisis for so many kids. We've had teachers who've been struggling to connect with their students, family members who have felt fairly alone in trying to provide education remotely without that human connection to what's happening with the class, the peers, and the educators. And now, 100% of those students having reported through their schools a lack of connectivity have been connected through this effort. And we just wanted to share that this has been a primary priority for the department and for all of our partners who have supported the work.
Great.
Thank you.
Thank you, Commissioner. We will now turn things over to our colleagues over in the media. And today's first question is from Patty White over at Maine Public.
Hi, can you hear me?
Yeah, sure can, Patty. Go ahead.
Great. I've got a question both for you and Commissioner Makin, but I'll start with you, Dr. Shah. So you said that you expect to start using the IDEX test on Monday. Can you tell us where things stand with the staffing needs that go along with ramped-up testing, from additional lab staff to contact tracers? And I know that yesterday you mentioned that we've got 30 contact tracers, but in the past you've said we probably need to boost that even higher to 60.
Great. Thank you for those questions, Patty. So Patty asks us about our overall staffing levels. First at the lab. You're right, Patty. One of the pieces that was absolutely vital in being able to expand our laboratory testing capacity from about 2,000 per week, where it was before, to now over about 7,000, was not just having more equipment, not just having more reagents, but having team members who could help out with that, both from a laboratory testing perspective as well as from a data entry and an analytic perspective. So our team at the lab has actually been interviewing folks all week, and I believe we have hired now 4 additional administrative staff members to help out with the data entry and data analytics, and it's what's called accessioning, the process of taking samples in, and the reporting, the process of reporting those results back out. And so interviews have been going on all week. I believe it's 4 additional staff members who have been brought onto the team. And of course, they are, again, vital to the overall effort of expanding our overall throughput. Now on contact tracers, the plan there, Patty, is a stepwise one. What we're doing is continuing to hire up more and more individuals who can work on contact tracing as the number of cases rise. So our overall goal, depending on where the outbreak may peak, is to hire up to approximately 110 individuals. We've been revising those based on what we see as the need to make sure we're adequately caring and contact tracing each and every individual across the state. That process is not one that will be a light switch that we flip. It's going to be a dial that we continue to turn up as the outbreak and the complexion of it changes. If case numbers dwindle, then we may be able to turn the dial back down. But I want to say one really important thing, Patty, about contact tracing. We talk a lot about contact tracing, but I think sometimes we may not appreciate that for many groups across the state of Maine, receiving a call from the Maine CDC is not something that they may be used to. In fact, I think for most folks across the state, getting a phone call from someone who says they're from a state agency and wants to talk about the fact that they might have been exposed to a disease that they may have only heard about on the news can be jarring. We fully recognize that. But more than that, Patty, we recognize that for certain portions of our community, that phone call may not just be psychologically jarring, it may be something where the communication itself just can't happen and needs to happen via an interpreter, a translator, or a cultural broker. I've had the opportunity to have conversations with members of the New Mainers communities and other immigrant communities across the state, including one just earlier today. And they've made very clear to me that we're not there yet. And we have more work to do in order to ensure that our contact tracing adequately meets the needs in a culturally respectful way of these populations for whom any kind of call from a government agency in and of itself is jarring, but we need to make sure that we're able to do so in a way where we're communicating in a culturally sensitive and appropriate manner. The members of those communities, I thank them for bringing these needs front and center to me, and we have heard them, and we're making sure that as we go through this process, we fully integrate their concerns and make sure they are at the table with us, being a part of that contact tracing effort, not separate and apart from it. So thanks for that question, Patty.
Thanks. Can I ask a question of Commissioner Makin?
Oh, yes, I'm so sorry. My apologies. Please.
No worries. Thank you. Commissioner Makin, can you tell me how long the state is planning to provide these new devices and internet connection for students, and how that affects reopening in the fall? Does having those devices make it less urgent for schools to open their doors?
So the question is, how long will the devices and the connectivity services be available to students, and does that have an impact on whether or not schools will be opening their doors in the fall? Thank you very much for that question. And I guess the answer is that we have purchased ahead of time 6 months worth of connectivity, cellular data service, in most cases for students who needed the connectivity. Those sometimes come with a MiFi device or with a tablet, and those are permanently going to be with the families, the students, through the schools, making that provision. Going forward, we're hoping to be able to support schools and hoping that schools will have time to support through their school budget processes ongoing connectivity for those students in the event that we're unable to be fully back full-time with everybody in person. Our hope, of course, is to have every single child and all of our teachers back in a safe, healthy environment at school. That is our #1 priority. We're working very hard with a group of student cabinet members, with family members, and with our partners in all the realm of school leaders and educators. And we're working to create plans that would allow us to be ready to go back in person, to also perhaps be ready to go back partly in person with some people who might be in high-risk groups, being at home and also receiving a robust and meaningful educational experience. We're also preparing for the event that that might not happen, and we're preparing for a 4th scenario whereby we go back to school and something else happens with this extremely unpredictable virus, and we end up in an emergency out-of-school situation again. All of those scenarios are being looked at by our school safety center, by a team of school nurses, by experts and specialists in the field, and by our partners here at the CDC. And we're going to make the best decisions we can.
Great. Thank you, Commissioner. And sorry about that, Patty. Didn't mean to cut you off earlier.
Dr. Shah?
Yep.
I hate to ask this, but is there any possibility that somebody is not muted and they're banging away on a keyboard so loudly I can't hear a thing?
Okay.
Can we ask that person to mute their phone?
Yes, by all means. Okay. So if there's someone who's not on mute, if you could please mute yourself by hitting *6, and when you're up in queue, by hitting *6 again to unmute. So thank you. We'll see how it goes, and then keep me posted. We're not able to hear that background noise here, so thank you for letting me know about that. We're going to go next to Kate Koff over at the Ellsworth American.
Thank you, Dr. Shah. So both of my questions are for you, and they're related. So correct me if I'm wrong, but my understanding is that the state is sort of buying PPE, in bulk and then distributing it to these organizations that need it. I am wondering, can you tell us if the organizations that get that PPE are going to, or maybe they already are, fully reimburse the state for the cost of it? And then if that's not the case, are they going to be returning it to the stockpile? And are they billing the patients for the use of that or for the PPE?
Okay, great. And then let me just write those down so I don't forget. So Kate asks about what happens after PPE is distributed. As everyone has heard me talk about, we have pushed out hundreds of thousands of pieces of PPE to healthcare providers across the state, principally to congregate care settings like nursing homes, as well as to first responders, like locally based fire, rescue, and EMS. So Kate, your first question is whether they reimburse the state, whether there is a charge for that PPE from the state. The answer is no. The PPE is pushed out to them. It's part of what we do at the Maine CDC, working in concert with our colleagues at the National Guard and the Department of Transportation. This is what we do in emergency situations. There's no bills, there's no reimbursement. You ask then if the PPE is unused, whether it's returned to the stockpile. And the answer there is no, mainly for the same reason as, if you go to the pharmacy and you pick up a prescription and it turns out you decide not to use that particular medication, the pharmacy won't take it back. And it's sort of similar with PPE. Once it's been pushed out, we have to make sure that anyone who receives it knows that it hasn't gone through an additional set of hands. So once it's pushed out, if it's not used, then it does not get returned to the stockpile. Now, what we have found, especially in large-scale pandemics, like the one that we're in now, is that there's not a lot of excess PPE that's sitting in hospital or firehouses across the state. Just the opposite. A lot of our deliveries are making sure that facilities can keep going. We're not aware of any reports of large-scale stockpiling of PPE. And then finally, you ask of whether the facilities are allowed to bill for it. And the way that the system is set up, the answer is no. Facilities are not allowed to bill the federal healthcare programs for any of the PPE that they receive from Maine CDC. That is a service that is provided, and they're not allowed to submit any bills for it. Thanks for that question. We will turn now over to Amy Brown over at WERU.
Thank you, Dr. Shah. First question I want to ask on behalf of someone who sent this question to everybody on this call, I think, which is, what is the level of daily testing required to safely reopen for tourism with social distancing?
Sure. So Amy asks about the level of testing that could be required for any situation, specifically tourism. And Amy, you know, the answer there is that the science is still out on that question. Because the pandemic globally is just a few months old, there hasn't been a lot of analysis around the exact number of tests that might need to be conducted in order for there to be, you know, a zero chance that there could be an outbreak related to tourism. What we know, though, is based on some other countries that have experienced COVID-19 before the United States, is that in general, a level of testing that allows states, jurisdictions, to get to a roughly 2% overall positivity level means that there is a wide enough net that's being cast so that anybody out there, whether they are a full-time resident or an occasional tourist, an occasional visitor, can have access to it. The positivity rate in that respect is a proxy for the overall amount of access that's available. That's why one of our goals is to try to get our overall positivity level down to about 2%. In concert with that, we also know that probably more testing overall capacity will be needed. And so that's why we've been working with hospitals as well as private commercial laboratories to help them get the technical assistance they need to ramp up their testing as much as possible. The third variable is how much testing would an occasional visitor to the state of Maine really need? Meaning a lot of folks who may come here, if they're only here for a day or two, would they actually be tested in the state versus going back home? Those are the type of questions that we're working with our colleagues at DECD to try to get a better handle on, because it will help us as we're planning for any potential ramp up over the summer.
Thank you. And a follow-up, if I may. What kind of numbers are you looking at, and which numbers are you looking at to determine when and if it will be safe to allow tourists to come back into the state while practicing social distancing and wearing face coverings without the 2-week quarantine? Is there any metric that you would see that would predict within this summer that would be safe enough?
Yep. So Amy asks about what type of numbers and metrics that we are looking at specifically as it relates to tourism. And Amy, the answer is, in addition to the 6 standard gating criteria that we've talked about, we actually just updated our numbers there on our website just yesterday with the latest figures on where Maine stands with our gating criteria. And those data are available on our website. The other variable that we have to look at is what might be happening in other states. So as we think about reopening within the state of Maine, the gating criteria that we've talked about, as well as this positivity rate, those are the things that we think about as it relates to the internal reopening of Maine. But as we look at external reopening, tourism in particular, but other forms of places in which visitors may be coming, it's important for us to continue looking at the overall prevalence of the disease in neighboring states, as well as the other states in which we know that visitors come from Maine. Well, we've started taking a look at those data, again, in partnership with our colleagues at DECD. And what we found is not surprising to folks who are listening and watching the news every day, which is that virtually every state around Maine, in fact, every state within the Northeast, has a higher prevalence of disease of COVID-19 than the state of Maine. New Hampshire and Vermont, even though Vermont has half the number of people, they have about the same number of cases. New Hampshire has about the same number of people and significantly more cases, to say nothing of, for example, Massachusetts, which is now well over 80,000 cases as compared to our 1,600 cases. So, Amy, in addition to the gating criteria that we look at internally, we're also now looking at the dynamics of the disease in other states, because those are the places that visitors would be coming in from. So we've got to take a sense of what the disease looks like there and how that affects how we would think about anybody, higher numbers of people coming in, and what the likelihood is that they may bring the disease with them. It's a very difficult balance, and it's one we're pretty actively involved in right now. I'm going to turn now over to Terry Stackhouse at WMTW. Terry, are you with us this afternoon? All right, we're going to come back to Terry in just a second because we will turn to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have a question for you and for Commissioner Makin. I also would like to point out that I was not the unmuted typist earlier on this call.
Understood.
Can you give us an update on the first shipment of remdesivir and how it's working? And you mentioned that there's enough for 35 patients, I believe the original shipment was for 50.